So, welcome to today's webinar, where one of the Cardiomyopathy UK nurses, my name's Jane, so it's nice to see you. And today we are following up from our national conference, which happened on the 16th of November, and we're just asking Helen Alexander some questions that were left with, after the meeting, so that Helen can go through those with everyone and they can be available for people who ask those questions to listen to. So I'd like to say thank you very much to Helen Alexander, who's joining us today. And Helen will just introduce herself now.
Thank you, Jane. Thank you for the invite. It's great to be with you on this call. My name's Helen Alexander. I'm a physiotherapist by background. My current position is I work for Nuffield Health in central London at one of our hospitals, where I support and deliver cardiac rehabilitation.
Thank you, Helen. So excellent talk at our national conference on the 16th of November, as I pertained to earlier. I know that you gave a lot of overview around exercise in relation to cardiomyopathy, and I know that you answered lots of questions as part of that talk. And then you had a queue of people asking questions, and you were lovely enough to answer all those. But there were a few that had been written down that we just didn't get around to. So we thought, wow, why not get Helen here? And then, ask those questions in person. So if you're interested in Helen's talk at our national conference, that's available at www.youtube.com/Cardiomyopathy UK. If you hit the subscribe button, then you'll be able to know when all the videos from the conference are loaded and when this webinar video is loaded. So without further ado, let's go through some of the questions. So we've grouped the questions together. So if you don't hear anything particular about your condition, just hang on, because we will be getting to other conditions within the exercise questions in cardiomyopathy. So first of all, Helen, can you just tell us a little bit about the relationship of left ventricular ejection fraction, so the pumping of the heart, on the amount of exercise? And there's a little bit about arrhythmias, if you could just mention that.
Yeah, absolutely. Well, certainly I would always consider what someone's ejection fraction is when I'm discussing exercise with them. It's always something I'd want to know and I'd want to look at. However, the evidence shows that we do know there's quite a poor correlation actually between what someone's ejection fraction is and what their physical capacity is. So I think it's really important we shouldn't assume that just because someone's got a low ejection fraction, they'll have low fitness or be, not very capable of being active. If you've always been physically active, you can often compensate better for that poor pumping function of the heart by having strong, efficient peripheral muscles. And therefore, you can usually manage everyday activities and exercise without being limited by symptoms. However, there is a link between the low ejection fraction and a higher risk of arrhythmias, which is why some people with very low ejection fractions might be offered implantable devices. And it's why we might actually be a bit more cautious with the exercise intensity if we've got someone with a low ejection fraction.
Thank you, Helen. That is really understandable, and thank you. So around exercise in dilated cardiomyopathy, is there anything specific in regards to that you wanted to go through that you could discuss with us? So for instance, can I run a marathon?
It's a really good question. I would direct anyone with dilated cardiomyopathy back to the original talks from conference, because I give quite a good overview of what the exercise recommendations are for DCM. I would say the volume and the intensity of exercise is certainly something for discussion with your cardiologist, because it really depends on your risk profile. So your cardiologist will consider your current symptoms, your history, your scan reports, so your echocardiogram and maybe MRI scans, any ECGs, and they'll consider all of that information to make a very personalised recommendation for you. If you're someone who's got particular markers of increased risk, so you've had previous cardiac rhythm problems, maybe collapse or cardiac arrest, you've demonstrated unusual rhythms on exercising ECGs, you have got some fibrosis on scar on your MRI, or you've got poor pumping function, so sort of below 40%, or you've got high risk genotypes. So there's particular genotypes called lamin AC and filament C where we'd be more cautious with you. So if you've got those risk markers, we might be more cautious. If you haven't, we can often be a bit more lenient. So if you carry a gene, so you're gene positive, but you've got no changes on your imaging, you're very well, you've got no symptoms, actually, as long as you haven't got a high risk gene, you can proceed to do all forms of exercise. So you could run a marathon. If you're asymptomatic, you're really well treated, so you're really stable, even if you're on medications, and you've got good pumping function, so maybe an ejection fraction of over 50%, you also can proceed to do all forms of exercise. However, if you've got any markers of increased risk, so those things I mentioned already, we'd urge you actually to avoid high intensity exercise and participate only in low to moderate intensity. So I would consider running, particularly running big volumes like a marathon, to be a high intensity exercise. So in summary, it is really a discussion with your cardiologist who can look at all of your risk factors and make an informed decision about something like that.
Thank you. That makes really good sense. Absolutely. And you know, is there a benefit, do you think, from going above the recommended limits of exercise to build a strong heart? So the government guidance says around 150 minutes, which is 2 hours and 30 minutes of moderate intensity exercise. So, for example, brisk walking or cycling. Is it beneficial going above those?
I think for me, it really depends on what you want to achieve from exercise. If you're looking to generally improve your physical and your mental health, then that can be achieved by 150 minutes of moderate intensity exercise a week. If you go above those levels for a period of time for any reason, perhaps you're training for an event or something like that, and then you return to those maintenance levels, your fitness will fall again in line with the change in your activity levels. So it's not like you can bank fitness and then keep it or store it, unfortunately. We know that many of the changes that occur with exercise are peripheral, so they happen in our large muscle groups and the circulation. So in terms of trying to gain a strong heart, actually, when we exercise, there's not big changes in the central function. It's more about the peripheral changes. So when we're exercising to improve our health and to improve our overall cardiovascular function, the changes happen in our big muscles and our circulation that feeds those muscles more than the central heart function, if that makes sense. I hope that answers that question.
Yeah, that does. That does. Really excellent. And so if, for example, I was a runner and I had a family history of the TTN gene, and I haven't had genetic testing done, is there any advice around that? So if I haven't had genetic testing, but I know there's a family history.
It's really difficult. I think it's really difficult for individuals that know they've got a family history and they maybe potentially could carry that gene, but are either waiting for testing results to come back or maybe haven't even decided if they want to be tested yet. That puts you in a really difficult place because you're like, which of the recommendations am I following for myself? We know that the mutations in the TTN gene that are linked to dilated cardiomyopathy are a variant of the condition known to have a higher risk of arrhythmias. For someone that hasn't yet had the genetic testing, if you're going to give yourself the lowest possible risk of dangerous heart rhythm disturbances, you almost have to assume you might have it and then follow the guidance, which would be to avoid high intensity exercise, to proceed with low to moderate as long as you're asymptomatic, but to avoid high intensity. If you don't want to stop running altogether, then the best thing you can do is probably reduce the volume of running and try and reduce the intensity of running. So still do some running for your general health, but maybe try and pull back on the pace, pull back on the volume, as long as you're symptom free. If you're running and you have symptoms at all, chest pain, dizziness, fainting episodes, absolutely you should stop and seek medical advice.
That's good advice, Helen. Thank you. And this is around another type of cardiomyopathy called hypertrophic cardiomyopathy, so HCM for short. Around hypertrophic cardiomyopathy, will increased exercise result in an increased acceleration of thickening of the heart muscle, do you know?
That's a really good question. Yes, I assume this comes from someone with HCM. I think the place this comes from is we know that athletes can see a slight thickening of their myocardium with large volumes of exercise, We tend to only see this in elite athletes or people doing very large volumes of endurance training, not in people who just go to the gym regularly and do some regular running. However, we know that for patients with hypertrophic cardiomyopathy, it's not related to their activity levels, it's related to the disease process itself. So there is quite a difference between the thickening related to the clinical condition and a thickening in athletes. I wouldn't expect someone with hypertrophic cardiomyopathy to get an increase in acceleration of that based on exercise. That would be based on the disease process itself.
Thank you. And does evidence indicate that exercises reduces the likelihood of onset and progression of HCM? Is exercise sort of good?
Well, we certainly know that for people with HCM, exercise is really beneficial for lots of physical and mental health conditions. It really reduces your risk of other health problems like diabetes and obstructive cardiovascular disease, heart attacks and strokes, for example. But in terms of the condition itself of HCM, there really isn't sufficient evidence at the moment to support any change in the natural progression of the condition based on exercise levels. But I would say the importance of exercise in terms of your general health is really important.
Yeah, thank you. And heart rate variability. So, if your heart rate varies a lot from sort of 40, 50 beats a minute up to 120, could there be a relationship to hypertrophic cardiomyopathy?
Potentially. There are lots of things that have influence over heart rate variability. And I think with smartwatches and devices, we're all a bit more aware of that now as a thing we can monitor. So heart rate variability is just your heart rates. It reflects your adaptability, I suppose. So if your heart rate is highly variable, that's normally evidences that your body can adapt to changes. Whereas if you have poor heart rate variability, that might indicate you need to manage stress better, or maybe ensure more recovery after exercise and have a better balance between activity and rest. In terms of the usefulness of monitoring heart rate variability, for example, with a smartwatch, for people with any form of cardiomyopathy, is I'm aware the algorithms in these devices have often been done with people who are healthy population and not been done for people who have got any form of heart condition. So I'd be a bit cautious probably about relying on the data from a watch around heart rate variability. We're also aware that medications you might be on will have an influence over your heart rate, as will the regularity of your heart rate. So if you're in a normal sinus rhythm, so a regular rhythm, then maybe the readings you're going to get are more reliable. Whereas if you're in an irregular rhythm, like atrial fibrillation, or you tend to have ectopics, I'd say probably the data we get back around heart rate variability is less likely to be reliable.
Yeah, that makes sense, Helen, absolutely. And weighted vests is another question. Are weighted vests okay? Some people like to wear them when they go to the gym, when they go running, just to give them a bit more, exercise. So are they okay?
Bit more of a challenge. Yeah, so weighted vests are just a way of making any exercise harder by adding load or resistance. Some people might do it by wearing a rucksack instead, for example. I'd say a weighted vest is probably more comfortable than that. I'd say probably the decision about whether to use one or not depends on your current fitness. So if you have no indicators of high risk, you're generally fit, and you find that with the current exercise you're doing, it's not really challenging you, then potentially adding a weighted vest is going to add extra challenge, and there's no harm in that. However, I would say start with short periods of wearing it and see how you tolerate it. Start with a lighter vest and then build up gradually.
Thank you. And you mentioned smartwatches earlier in regard to sort of heart rate variability. And I know that people, a lot of people wear smartwatches now. If you've got an implanted device, so an ICD or a CRT device, can you wear an Apple Watch? And is there anything we need to be aware of?
I think this is an area where maybe the jury's out a bit, I'll be honest. The concerns with some smartwatches, including the Apple Watch, is that they contain magnets. And we know that there is a recommendation with any implanted device to keep a 6-inch gap between a magnet and an implanted device. Now, obviously, if the Apple Watch is on your wrist, that is quite a distance from your device, but there might be periods where your hand is up near your chest, and there's potential for there to be influence between the magnet and the implanted device. They also have a function called bioimpedance. So that's where it sends these small signals into the body and reads the signals that come back. And that's how it gets all the data on body fat percentage, heart rate, stress levels. I think the reality is there isn't enough research yet to fully understand the interactions between these watches and implanted devices, because there's the potential for interference. I'd say it's maybe a cautious approach with wearing one. I'd say it's probably a conversation to have with your pacing clinic when you go for your next check. And they can advise you based on the manufacturer of the device, what that particular manufacturer would recommend, because I'm aware the manufacturer's guidance does vary quite a lot with these appliances. It's an evolving area, they're changing all the time. But I'd say have a discussion with your individual clinic when you next go for your device follow-up.
Thank you, Helen. And how much notice, say you've got an Apple Watch, for instance, and you're looking at the VO2 max, cardio fitness scores, how much reliance should we take on those?
Yeah. So in simple terms, VO2 max is that measurement of your body's capacity to utilize oxygen. So it's a basic fitness score. So smartwatches collect lots of data when we exercise, and then use algorithms to establish your oxygen consumption. It's a bit like the heart rate variability. The algorithms are based on healthy people without heart conditions. Other things that might influence it are the medications you're on. So if you're on beta blockers that are going to blunt your heart rate, that will probably have an impact on those VO2 max scores. And the devices aren't advanced enough to know whether you're on a beta blocker or not. And it also, the regularity of your heart rate will have an influence on those scores. So I would say this technology is still evolving. There's still debate about how accurate those results are. I'd probably not get too fixated on them. If you want to monitor your fitness levels, think about how far you can walk in a set time and how that feels. As your fitness improves, you'll be able to walk further, walk faster, with less feelings of exertion. So you won't get as breathless when you're climbing the stairs. You won't get as breathless when you walk uphill or go for a run. That for me is probably a more reliable indicator of your fitness improving than the numbers on a watch.
Thank you. That's great. Very reassuring to know. And somebody has asked about AV node ablation. Now it's very specific to them, and they've said they've got a bi-ventricular ICD, so that means they've got 2 leads. And is checking your pulse accurate when they exercise if they've had these procedures done?
Yep. So if someone has had an ablation, hopefully now they're in a regular rhythm. So yes, if you're in a regular rhythm, then checking or monitoring your pulse or heart rate would be accurate. However, for anyone who has an irregular rhythm, for example, atrial fibrillation or someone with a high ectopic burden, monitoring your exercising heart rate, particularly with a smartwatch, is less accurate. And actually, for individuals I work with, if they're in stable atrial fibrillation, I recommend not monitoring heart rate at all and actually just going on how you feel. Because when you're in an irregular rhythm, the numbers will be jumping around quite a bit, which can be quite disconcerting and not very reliable. So again, go back to how your body feels when you exercise, get very familiar with those feelings of exertion and how you feel when you're at the right intensity, and use that rather than heart rate.
Yeah, that makes sense. Absolutely. And somebody who's got a diagnosis of arrhythmogenic cardiomyopathy, so that's another type of cardiomyopathy. We've mentioned dilated cardiomyopathy, hypertrophic, and now we're talking about arrhythmogenic cardiomyopathy. So if somebody hasn't got the gene identified in them, and they've certainly got the diagnosis of the condition, what advice would you give around exercise? And I know it's complex.
Yes, it is. And again, go back to the original talk from conference about arrhythmogenic cardiomyopathy, because I give some very specific advice for this condition. One of the challenges of this condition, as we know, is that exercise, if done at sufficient volumes and intensities, can actually lead to progression of the disease itself. And it can therefore lead to an increase in heart rhythm problems. By gene elusive, I assume this person means their clinical team has based that diagnosis on clinical findings, which can happen. So typical ECG changes, MRI findings, maybe symptoms, but the gene test itself hasn't come back positive. That doesn't mean it won't ever. And we know that gene testing is evolving and they're finding more and more variants. It might be if that gene testing is repeated at some point in the future, that result might change. However, for someone who's phenotype negative, so feels well and has no significant changes on any of their scans, but has got a diagnosis, the current advice on exercise intensity, to place yourself in the position of least risk of disease progression and heart rhythm problems, is actually to only do low to low end of moderate intensity exercise, and also to avoid large volumes of exercise. Now, I'm well aware this is really challenging to hear for some individuals, because often they're someone who's been very active in the past and has really enjoyed doing endurance events, and then has to make a significant change to their exercise volumes. And exercise has often been a really important part of someone's life. It's part of their identity. It's potentially even their career. To then change your exercise levels is really, really hard. So I'd say try and get some support if you can, get some guidance on what the best way forwards is for you to ensure you get all the benefits, all the health benefits of being active, but at safe intensities. I've often guided people with arrhythmogenic cardiomyopathy towards other forms of exercise where they can still feel good about their body and good about their mental health, but doing safe intensities and volumes. That might be yoga, might be Tai Chi, it might be some strength training in the gym, which we can often do at lower heart rates.
That's really good advice, thank you. And you mentioned strength training. Certainly low impact exercise and things like that. What would be your guidance around sort of a low impact?
Yeah, absolutely. I think when we're talking with people with heart conditions about exercise, the first focus is aerobic or cardio exercise, and that has got a place. But I'd say strength or resistance training is equally as important. So particularly as we get older, doing some strength training twice or 3 times a week in a targeted way can be really important in improving your overall health. And it is low impact often. So low impact exercise is just exercise where we're not putting too much sudden load through our limbs and joints. And there are lots of strength exercises you can do at home. Start with simple body weight exercises, sit to stand from a chair, which you can progress into squats. Heel raises, going up and down on the toes to strengthen the calf muscles. Wall presses, where you've got your hands up against a wall in front of you and you're moving forward and back towards the wall, and then you can gradually make that harder. You can then add on resistance, so you might get some light weights at home. You might use resistance bands. So there are lots of easy ways of doing some home-based strength exercises if you haven't got access to a gym or equipment.
Thank you. And are there any restrictions around strength exercises? So what about if you particularly wanted to do weights and lift them above your head? Is there any advice over that? And, can they make the heart thicker?
Yeah, it's a really good question. I think there are lots of misconceptions about lifting weight over our head. I think some people in the past have been told you must never lift weight above your head if you've got a heart problem. However, we know essentially in everyday life, we need to lift things above our head. We need to be able to put things away in cupboards. We need to be able to hang out the washing. So it's really important that we're strong enough to do those things. However, we know that sustained overhead lifting, so that would be where we're holding weight above our head for a sustained length of time, is harder work on the heart and the lungs than when we're moving our arms up and down. So I'd say what you should aim for if you want to get stronger with your arms is to do exercises where you're lifting weight over your head, but moving your arms up and down rather than sustaining them in a hold. And start with a weight that you can lift comfortably 12 to 15 times. And then gradually, as you get stronger, you can increase that weight. So get the weight right for you. and do exercises where you're moving your limbs rather than holding them still.
Thank you, Helen. And are stretching exercises good, for blood vessels as they are for sort of our bone and muscle, for instance?
Yep, so stretching exercises are things that benefit our muscles and soft tissues. And it's really important as we get stronger that we maintain the flexibility around those muscles and joints. So good to include some stretching. I would say always stretch muscles when they're warm. So do the stretching after the exercise session rather than before. Stretching a cold muscle isn't comfortable and can cause injury. And hold stretches for about 20 to 30 seconds and just stretch the main muscle groups in your arms and legs, the ones that you know feel a bit sore from exercise. Stretching, however, doesn't really influence our blood vessels. So because our blood vessels don't have the same properties as muscles do, the collagen and elastin levels are different, we can't really influence our blood vessels by stretching. However, when we exercise regularly, when we do exercise that makes us a bit warm and a bit puffed, that does mean that our blood vessels are more responsive to states of rest and exercise, and it ensures that our arteries don't get too stiff, and that can be linked to high blood pressure. So regular exercise is good for our blood vessels, but it's not really about the stretching, it's about the health of our blood vessels.
That's great. And maybe to do with stretching, sort of yoga. So some people, I know you mentioned it earlier, enjoy yoga as
Yep.
part of their activity. And it doesn't necessarily mean running a marathon, but, good activity can be in the form of yoga. Are there any poses which we should avoid at all, specifically around hypertrophic cardiomyopathy, for example?
Yeah, so it's a really good question. Yoga is a great form of movement. I'm aware there are lots of different types of yoga now. So when I am working with someone who wants to do yoga, I'll ask if they've got a particular type in mind. However, broadly, I would say the one concern with yoga and cardiomyopathy is that if you typically have low blood pressure, you may struggle with postures where your head's down towards the floor. You also may struggle moving from one posture to another, so from the floor into standing and then back down again. A downward dog would be a good example. So I'd say if you're someone where you tend to have low blood pressure and you find that those movements make you feel more lightheaded or dizzy, just adapt things so that you're moving from one position to another more gradually. If you're joining a group class, I'd always let the instructor know that you have a heart condition, but that you've been cleared to exercise, and maybe ask for simpler versions of some of those postures when you're new to it before progressing to more advanced ones.
That sounds really sensible. And one question around sort of general exercise is, cardiac rehabilitation. We know that it's offered to people with coronary vascular disease, which is different to heart muscle conditions. But is it available for all cardiomyopathy patients in all areas at the moment?
It's a really good question. For those who don't know much about it, cardiac rehabilitation is a structured program of exercise and support to make lifestyle changes that might benefit your overall heart health. Sometimes those sessions might be offered in person, so group exercise classes in either a community, a gym, or a hospital environment. Sometimes they might be remote, so delivered live on a virtual platform, or they might even be hybrid, so you might get the option to combine those two options. Unfortunately, although we know that many people with cardiomyopathy may benefit from lots of aspects of cardiac rehab, it isn't as widely available as we'd like it to be. This is mainly because there is variation across the country in how programs are funded and commissioned. Some have very broad eligibility and are able to see people with all kinds of heart problems, and some are far more restricted in terms of who they can accept. I'm really pleased to say that Cardiomyopathy UK and the British Association of Cardiovascular Prevention and Rehabilitation, so BACPR, are working really closely together currently to better understand this. We've got a survey out of healthcare professionals, and I know that the last Cardiomyopathy UK survey asked people affected by cardiomyopathy about their access. So it's an area that we're actively working on to try and improve access. And my hope is that in the future, everyone with cardiomyopathy that would benefit will get access. I would say if you're not sure if it's available in your local area, speak to your specialist nurse, speak to your cardiologist, speak to your GP and ask the question. I think there's no harm in asking for a referral, and in a way that actually increases the awareness of the benefits in your area.
Thank you, Helen. That's amazing. And, you know, certainly I hope that everyone here, you know, who's asked those questions or interested in those questions from conference has, you know, watched the initial video that's on our YouTube channel at www.youtube.com/Cardiomyopathy UK. And hopefully, you know, you've listened to those and you've got a lot of answers to the questions that you might have that you want to pose in the future. So thank you very much, Helen. It is so much appreciated by Cardiomyopathy UK for the answers to your to the questions that were posed. Just be aware, audience, that any medical information, advice and guidance given in this video is only general information, and please be aware that it might not be applicable to you. So as Helen said, check with your specialist nurse team, check with your cardiologist, and make sure that information around exercise is intended for you. Also be aware that today's video is intended for a UK audience, so it may not be applicable if you're outside of the UK. And Cardiomyopathy UK does not accept responsibility for any actions taken after watching today's webinar. But thank you again for listening. Thank you, Helen. And it's been really nice. And I hope that you enjoy our YouTube channel. And if you do, please subscribe. Thank you.
Thank you, Jane. Goodbye.